COVID-19 and congregate living. I'm Adrienne Pedersen. Today on Upfront. Has coronavirus revealed vulnerabilities in long-term care? I'll ask an industry leader. That's next on Upfront. Plus,
the recommendations, they don't come with a partisan lens. They come with the lens of reality.
Lieutenant Governor Mandela Barnes on the Climate Change Task Force recommendations. And what changes are Republicans contemplating in state election law?
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us today. We begin with the next phase in distribution of the new coronavirus vaccine in Wisconsin. Frontline healthcare workers have been getting their shots. Under CDC guidelines, residents of long-term care facilities will be next, and it will be a big task.
It's going to take, several months before we are able to administer as a state over 200,000 doses to people who live and work in long-term care. So it's a massive endeavor.
COVID-19 has hit long-term care residents and seniors particularly hard. The majority of COVID deaths occur among people in their 70s and 80s. Has the virus exposed vulnerabilities for people in congregate living situations, and are changes needed after COVID-19 passes? We're asking Rick Abrams. He's the president and CEO of the Wisconsin Healthcare Association and the Wisconsin Center for Assisted Living. Rick, we appreciate your time. I know you're very busy right now, especially with this vaccine coming out. So go ahead and give me the timeline for vaccine distribution in long-term care facilities as far as you know right now.
Sure, Adrienne. First, it's a pleasure to be with you, and I really appreciate this opportunity. In our long-term care facilities, first our nursing facilities, then our assisted living centers, everything is really going to get started on Monday, December 28th. We are working through a federal program called the Pharmacy Partnership. We're working specifically with CVS pharmacies and Walgreens pharmacies. And CVS and Walgreens will be at every nursing facility and then every assisted living facility at least 3 times in the coming months. And we expect that the program is going to continue through at least March. But again, with the 3 visits and with the 2 shots for the Moderna vaccine, which is going to be used in the long-term care setting, it will take just about that amount of time.
So do you think that everyone who is living and working in these facilities will have the vaccine by March?
Yes, we expect so. Certainly, if we run into some terrible weather, or if the expectation of vaccine supply is not what we had anticipated, that may be delayed. But we're not seeing any of that at all. So at this point, our facilities are getting prepared for their clinics. We're educating our employees. We're educating our staff, and it's our hope, indeed our expectation, that everyone who is offered the vaccine will take the vaccine. Very important.
I know one question that's come up about that is consent. So how do you plan to handle consent with residents who maybe really can't give it themselves and their family's not available? What do you do?
Well, we are going to try our hardest. Certainly for those residents who are able to consent, they will receive a fact sheet about the Moderna vaccine, as well as their guardians or powers of attorney. And we're just going to try our hardest to make sure that those residents who cannot consent, again, their guardians or their powers of attorney will have all the information that they need to make that decision on behalf of their loved one.
Is there anything that you would say after all this and seeing the vulnerabilities in this congregate living that you've learned that maybe needs to change going forward?
Well, long-term care, Adrienne, was suffering from a staffing shortage before the pandemic. What this pandemic has really shown us and has really exacerbated that staffing shortage. So as we move forward, it is our hope and again, our expectation with our policymakers that they have seen the vulnerability, and we look forward to working with them, not only to increase the base pay that we can pay our frontline workers, but also begin to create that professional pipeline so that we have a very, very deep supply of very, very committed employees on into the future.
Something else that's come up is this thought of immunity a lot. And Wisconsin at one point had the 6th highest rate of COVID-19 deaths in nursing homes among all 50 states. That's according to the AARP Public Policy Institute. So that being said, this immunity, protection from lawsuits, how important is that to the nursing home community? Is that something you're pushing for?
We are pushing for, very, very important. We want our folks under very, very trying times and circumstances to do their jobs without any hesitation. You know, the difficulty with COVID, not only in Wisconsin, but nationwide, is that the rate of infection in any congregate living setting, whether it be a nursing facility, an assisted living center, a meatpacking plant, is directly related to the community spread. And until we can get that community spread under control, and we've struggled with that in Wisconsin, we're not going to see the infection rates decline in our congregate settings.
Is there any concern, though, because unfortunately we have heard some horror stories, you know, national headlines of things that have happened in these facilities. Is there concern about still getting families to trust them and move into congregate living after this?
You know, we understand the concerns, but, you know, especially with the focus and the priority of the vaccine in our long-term care facilities, we believe firmly that within 2 or 3 months, the safest place that anyone will go will be in a long-term health care facility.
All right. Well, Rick Abrams, we appreciate your insight on this. We are certainly wishing you the best with this vaccine rollout. We know it's a huge undertaking. Thank you.
Well, I appreciate your time. It's a pleasure to be with you.
Coming up, the Governor's Task Force on Climate Change released its recommendations. I'll talk to Lieutenant Governor Mandela Barnes about the chances lawmakers will get on board. Plus, what Republicans are thinking about election reform.